Have you ever noticed a brown, waxy or stuck-on looking spot on your skin and wondered what it is? Today we're going to be talking about a seborrheic keratosis, one of the most common skin growths and often worries people. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon, and today we'll start our series on sessions on skin lesions. First of all, if you have a pigmented lesion that's changing in size, shape or colour, it's crucial to have this checked out by a doctor who can confirm a diagnosis. Do not use Dr. Google to diagnose yourself, and the doctor will properly assess you, and they may even need to do a biopsy to confirm the diagnosis to tell you exactly what it is and send it away. So once you've gone to the doctors, one of the diagnoses you may be given is called a seborrheic keratosis. What is a seborrheic keratosis? First of all, it's important to know these are benign skin growths, not cancerous or precancerous. They appear as raised brown or black or tan patches with a waxy stuck-on look. They're really common after the age of 40 and often run in families. The biggest concern is not usually that they're dangerous, but they can sometimes mimic other pigmented lesions such as a melanoma, so it's very, very important to have them checked out, or any pigmented lesion checked out. So let's peek under the microscope to find out what they actually look like. As I've already emphasised, they are benign overgrowths, or they are benign lesions. They are overgrowths of cells called keratinocytes, and they are on the outer layer of the skin. Now, the keratinocytes produce a substance called keratin, which is waxy, and because they're overgrowing and they're overproducing this keratin layer, they kind of layer the waxy substance one on top of the other, giving the appearance of the warty, stuck-on lesions. Think of it as layers of wax piling up on the skin with pearls of keratin trapped inside, and this is what gives it that crusty, stuck-on appearance. So what are the symptoms and concerns? Usually they're harmless and they're painless, but if they become large, they can catch, particularly on the bra strap or on the trousers, and they can cause irritation and they can become red. And that's when usually people become concerned. Diagnosis is usually made by a doctor looking at them. Sometimes we may use a dermatoscope, and rarely, if we're concerned, it doesn't look quite like a typical seborrheic keratosis, we may send it off. How can we prevent these lesions? We can't, unfortunately. They are age-related, usually coming on after 40. They're genetic, so it's just one of those things that people usually get when they're older. Risk factors are, if your grandfather's had it or your parents have had it, it's likely you'll get it. And they can happen in all sorts of skin types. Every skin type can develop seborrheic keratosis. What can you do? There's no proven cream or diet or lifestyle that can prevent them. Unfortunately, it's just one of those things that if you're going to get them, you're going to get them. If you know you're going to get them and you've already started to get them, what can you do at home? Well, keeping your skin well moisturised, using gentle exfoliation and preventing chronic irritation. I usually advise a glycolic acid soap and gentle exfoliation and moisturising after a shower, and these can keep things soft and prevent them from crusting up. Now, if they do become problematic or you don't like the look of them, what can we do? They don't disappear on their own, but there are certain things that we as doctors can help with. They can occur either isolated, so you may notice one or two on their own, or they can appear in crops. And how we treat them depends on if they are problematic, their size, and how many you've got. Now, if they're fairly small, one thing that we can do is spray them with liquid nitrogen called cryotherapy. And this will remove the lesions, leaving you with a small scab that takes about 2 to 3 weeks to fall off and leave healthy skin underneath. You may need 1 or 2 sessions for this to work. Now, if it's slightly large, cryotherapy may not be amenable. So one thing we can do is use shave excision, and that's under local anaesthetic. We shave the entire lesion off the skin, and that again leaves you with some raw healthy skin that just heals on its own. Now, if you have multiple lesions, what do we do? If it's multiple lesions, I will assess you and we will decide in one session how many needs cryotherapy and how many needs a shave excision. And we tend to do quite a few of them all at the same time. It's very difficult to get rid of everything at the same time, but the problematic ones we may decide to do all in one go and then allow things to heal, see how you respond. And if you do have lots, we may organise a 6-monthly session or an annual session where we just do a once over and remove all the problematic seborrheic keratosis. In the meantime, you will continue to moisturise and ensure that the smaller ones don't get too crusty and become problematic. There are other forms of treatment such as laser therapy, which are available, and you can speak to your plastic surgeon about this. So the best approach is to monitor your skin, moisturise. If there are any unusual ones, have it checked out by the doctor to confirm that it's nothing sinister. But once you've confirmed that it's a seborrheic keratosis, you can decide whether you want to have a shave excision, cryotherapy, and if your surgeon does provide you with that service, laser therapy. So the take-home message is that they are benign. If you are unsure, it's important to go and have it checked out by the doctor. And if you have any further questions, or if you would like me to discuss another type of skin lesions, do let us know.